something. And I have I've come to love Peggy too. This is an amazing church, and I'm learning church family as I come in and out. I have been on board with this church since April. Began work in May and June. We've already seen some amazing footsteps being placed. So just over the next 10 minutes, I want to share a couple of journeys with you. Peggy said I'm a registered nurse. That has spanned over 3 decades. I know, I started when I was 12. The first decade was clinical. I went in as a little snotty-nosed nurse thinking that I could change the world, and I cared for my patients with great love. I prepared them for surgery. I medically treated them. I stabilized their diabetes. I took care of post-amputees. I sent them to dialysis. And after 10 years, I realized that I had as many patients facing me when I came into work as I did the first day. I didn't think I was making a difference. And I thought if I could just get on the other side of their disease, maybe I could do something. So I started looking at prevention. And I worked in community health at TEDx. I did some behavior modification. Heck, I even taught high school. But I think I could teach high school students with the risky behaviors. Maybe we could make a difference as adults. Maybe we could rein in some of the chronic diseases. Maybe we could make a difference. But it wasn't until 1996 when I was introduced to a type of nursing that I'd never heard of before. It's called parish nursing. And the word parish means to walk alongside, to be a listener. You see, in the nursing world, so often we're the joke riders. By the time you're talking and telling me what's going on, I'm already at the plan of action. I figured out what's going on with you, and I've got you diagnosed, and I've already got the first 3 things that you need to do. But in parish nursing, it's a different view. You sit back and you listen to what they're saying to you. You're hearing them speak because it's their bodies. It's not mine. And as you're listening, you're also taking that need and interpreting it through the scientific knowledge that you have, and you're beginning to link them with resources to be able to make a difference in their life. What fueled that holistic approach for me was a gentleman that I met in Atlanta, Georgia. His name is Dave Hilton. And Dr. Hilton, who is a surgeon by training, had spent the first 10 years of his training in Africa. And as I listened to him speak, he sounded like a male version of me. Because he said, every day I went to the clinic, and my staff and I saw over 300 patients. And every day I performed at least 6 surgeries. And he said after 10 years I started looking and saying, these people are as sick today as they were the day that I met them. I'm not making a difference. If I could just get on that other side and I could start to look at what causes them to be healthy, what tools could I give them within their own villages that they could be more responsible for their own health. He said, the top 3 killers, heart disease, cancer, stroke. He said they're the same for the last 30 years. They're the same for the last 40 years. And over half of those deaths are because of lifestyle. Over half of those deaths could have been prevented or at least delayed if we had just made changes in our healthy lifestyles. Man, did that stick with me. And so I come back to what Jamie Oliver just said. For 30 years, we've watched childhood obesity rise. For 30 years, we've watched obesity in our country rise to a point of epidemic. It has now been declared an epidemic. And if we don't make some changes, what's happening to our children is going to impact their health in the future. We are seeing hypertension at younger ages now. We're seeing elevated cholesterols at younger ages. I just heard this morning that the American Academy of Pediatrics is encouraging to check children's cholesterols by age 9. Type 2 diabetes, seeing it as we've never seen it before in children. We got to make a difference. And I echo what Jamie Oliver says in saying that we should empower each person to fight obesity, but I take it a step further. I say that we need to change the environment in such a way that what makes the healthy choice the easier choice. Let's talk about Greenville. In Greenville, 6 out of 10 adults, 4 out of 10 children are overweight or obese. 50% of our African American children are overweight or obese. 44% of our Hispanic children are overweight or obese. These are numbers that are real. Each of these numbers have a face. When we look at the community, the 3 pillars, the faith community, the family, and our schools, 3 of the most influential areas in the lives of all of us, in the lives of children, what's going on in Greenville? Well, I got to give a shout out to the Long Branch Baptist Church. Not just because I work with you, but because you have developed within this church a health committee and a committee of people who really care about this church as a family. You have a pastor who has said, as for me and my house, we will eat healthy. He said that I had worked with over 120 congregations, and that's right. And never in any of the congregations I have worked with, African American, white, Hispanic, not one church that I have worked with have I seen the dedication coming from the leadership like I have in this church. And what that means for you is that not only does he care that he does not want you to be the next one that he preaches the funeral for, but that he truly cares that you not only have a life, but a life that is abundant. A life that you can put your hands on and can feel that you are happy and blessed, fulfilled, energetic, and that you will see your grandchildren. You know? I think about that little girl up there who lost her daddy, who died in her arms, and I think, you know, he missed walking her down the aisle. He missed seeing her children. And what a loss that is, because it was a preventable death that was declared coming from Huntington, West Virginia. So that's our faith community, and you have so much that you can teach other faith communities by the successes that you're having. You're in a 100-day challenge. And in that 100-day challenge, you have put your foot down and said, I'm going to make some changes. And it could have been something as simple as, I'm not going to eat ice cream every night, to, I'm going to lose 20 pounds in that 100 days. Whatever your goal is, it's your goal. And you're responsible for that goal. But the environment is making it conducive to you actually making those changes. Because they're weekly walks with the pastor. You come in and just have a walk with the pastor. Get some physical activity. You can go to an aerobics class here 2 times a week. That's not happening everywhere. You have nutrition talks. that open you up to having opportunities to dialogue about the best way to prepare food and even taste some different foods that are prepared a little differently. So I give that shout out to this faith community and say to you that you are doing such positive things that can be shared with other faith communities. Now let's talk about schools. That is 180 days out of a child's life. That is 7.5 hours out of a child's day. And it is important. It is an influential place for our children. Well, let's talk about what's going on in Greenville. Jennifer Sharp is the Director of Food Services for the Greenville County School District. And Jennifer has brought the Farm to School program to Greenville County schools. Over 28% of the fruits and vegetables that are served to our children come from local farmers. It is in its freshest state. And I am told that that's going to increase again during this year and on into next year. And we need to support that. We need to encourage our children to try new foods and to take in these fresh vegetables. There's a program called Catch. Greenville County Schools was a pilot for Catch for the state of South Carolina. And Catch, if you're not familiar with that, stands for Coordinated Approach to Child Health. Catch is an evidence-based nutrition and physical activity program. It has been implemented in every elementary school, and it's being piloted in some of the middle schools this year. Livewell Greenville, which is the organization that I've worked through, is taking Catch into 8 after-school programs so that there is a continuum of physical activity and nutrition being provided to our children in these 8 sites. So that's what's happening within your schools. Let's look at family. If you've got it in your faith groups and you've got it in your schools, can we automatically believe that it comes into the home? That is the hope. That is the hope that the modeling that takes place there will also provide it within the homes. But the home is your sanctuary, and things can go on in your home and nobody else knows about it. But let me share a story with you. This is a true story. But I'll say that his little name is Billy. Little Billy came home from school and he said to his mother, "Mom, I had 1 vegetable at school today. And my teacher says that I need to have 3 vegetables every day. So would you mind providing some vegetables for dinner tonight? I'd like for it to be green or yellow, maybe some orange." That mother told the school the impact that this coach and this teacher was having on her child, and that it was positively impacting her family because she realized that her son was right, that we do need 3 vegetables, at least. And that she wanted to provide the best environment that she possibly could for her children. So we do know that this is carrying over into our homes, and we hope that it will continue and we'll hear more success stories like that. So those are our 3 pillars that Pastor Dogan certainly wanted us to talk about tonight. And then in closing, I want to just share with you that health does come from within. And more so that each of us are responsible for our own health. And all of us are responsible for the health of our children. Thank you.